Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and contents here on our YouTube channel. Also, you'll be able to help support our community here at DamiRx Care in order for us to be able to provide more educative content here on our YouTube channel. So let's dive right into our topic of choice today. Our topic of choice today is dicyclomine. So dicyclomine is a medication that's used for stomach cramping as well as irritable bowel syndrome. So this medication is used in patients who are having like a gastrointestinal upset in order to help reduce it, as well as patients who have irritable bowel syndrome, which is also known as IBS, to help reduce their symptoms. That way it can kind of help regulate their gut function. So let's talk about the medication a little further. So this medication is taken as a 10 to 20 milligram 4 times a day. So usually some patients will have to take it as needed for stomach cramping, while some patients, they would prescribe you taking it every 6 hours in order for you to be able to complete the dose each day in order to help prevent those symptoms as related to gastrointestinal dysfunction. And usually the maximum for this medication is 40 milligram 4 times a day. So what are some side effects to note about this medication? So some side effects include nausea. It can cause dry mouth as well as dizziness. It can cause blurred vision. It can also cause somnolence as well as weakness in terms of fatigue. And it can also cause nervousness as well. So this medication comes in a capsule, it comes in a tablet, it comes in a solution, as well as an intramuscular injection. So what are some serious side effects that you want to reach out to your doctor immediately if you start noticing while taking this medication? So some serious side effects include seizures. So if you start noticing seizures shortly after taking this medication, you want to make sure that you're seeking urgent help immediately. That way they can help resolve the seizure, as well as be able to rule out if this is a side effect from the medication, or maybe the patient has another underlying condition that may be causing the seizure. Also, this medication can cause decreased breathing. So if you start noticing it, like I said, these are serious side effects that doesn't happen to everyone. But just in case if it does happen, these are serious side effects that you want to make sure that you're reaching out to the doctor for an emergency help for. Also, it can cause shortness of breath. In some patients, it can cause fainting as well as decreased sweating. The decreased sweating is very common among patients, so you want to make sure that you are staying hydrated while you're on this medication, most especially if you are going to go out or you're taking it during the summer months. This medication can cause a heat stroke, so you want to make sure that you're staying hydrated as well as staying away from the sun. That way you're not having that heat stroke, as well as also using a sunscreen as well. Also, you don't want to use this medication as a long-term medication for IBS because of these side effects, and as well as the side effects such as dry eyes and dry mouth. Also, this medication should not be used at the same time with antacid in order to help with the medication working effectively in order to help reduce that stomach cramping. And also, like I said, this medication may cause dizziness. So if you are going to be doing something that requires you to be mentally alert, make sure that you're aware of that, and you try to take the medication way ahead of time so it doesn't make you dizzy. Or if you've taken the medication a couple of times and, like I said, you don't notice the dizziness, then you can go ahead and, take it as prescribed. All right, I hope I was able to help in terms of what to look out for while taking this medication. Like I said, this medication is not a medication to use for a long-term period due to the dryness effect, such as dry eyes and dry mouth. And also, other side effects such as the dizziness, as I mentioned. So just make sure you're looking out for that. I hope I was able to help in terms of what to look out for when it comes to side effect, and also serious side effect that you need to be reporting to your doctor immediately for. Thank you for watching, and stay blessed.